my name is Dr. Rachael Lee, Rachael-Lee. I'm an assistant professor in the Division of Infectious Diseases here at UAB, and I'm the UAB healthcare epidemiologist.
I don't suppose you listened to the state health officer's news conference today, did you?
I did.
Okay, what jumped out at you or seemed point to reiterate about what he was talking today?
Right. So I think there's a few reassuring things that our algorithm for testing patients is working. You know, the health department is actively working with healthcare facilities to identify patients and to test them. And, you know, luckily we've had patients that are not, have tested negative for coronavirus.
Talking to Bob, as everybody's saying, self-monitor, you feel bad, contact your health official, but Bob was driving home the point. If you think you might have been exposed or sick, don't just show up at a clinic, don't show up at your emergency room, call in advance. Talk about why you need to do that.
Yeah, that's a great question. So one of the biggest things that we want to do in our healthcare facility is to protect our patients and to protect our healthcare providers. What we do know about this virus is that it seems to have a high rate of attack in healthcare workers, and so we want to do our best to identify these patients quickly. And also have our processes in place. So if you are sick or your loved one is feeling ill, call your healthcare provider, talk to them about your symptoms. If they feel that you need to come to the emergency department, they can then call the emergency department to let them know that you're coming, and then we can be prepared to care for them.
This might be a minute point, but apparently it's a serious issue. People have freaked out and started sucking up every mask they can get, and I think they've been trying to get over the N95s, which many can't.
Right.
The word today is don't do that because we got to protect our healthcare officials, people first, our first line of defense.
Right. So what the CDC recommends in terms of wearing masks is if you are feeling ill and you are coughing, masks are good for preventing the spread of viruses in that sort of manner. But if you're healthy and otherwise just going around and walking, wearing a mask is not going to protect you because A, it gives you a false sense of security. This is known to be transferred through droplet nuclei. So that means if it's on, if you touch something that's on like a doorknob and then you touch your face, that can then lead to having an infection. And so the mask is not covering your eyes, it's not covering those other kind of vulnerable areas. So number one thing that can really help you is washing your hands as frequently and often.
Surgeon General tweeted over the weekend saying, you know, to this point that people really need to stop buying it, that it can create a problem. Is it doing that now with shortages in medical supplies for providers?
Right. So I don't know if the lay people is causing a shortage, but we are nationally seeing a shortage of these N95 respirators, and that's mainly because a lot of the facilities that created them were in China. So and so hopefully we'll be able to see an increase in those numbers shortly as people are recovering from their illness and going back to work.
We've seen some of the images of grocery stores, elsewhere in the country with bare shelves. Are there any items that folks here in Alabama should be going and purchasing just to, possibly prepare for this?
Yeah, that's a great question. In terms of preparation, I would recommend having some sort of hand hygiene available, whether it be alcohol-based hand hygiene or just soap. Soap is cheap. It works well as long as you wash your hands according to the time frame that's needed, and CDC has a great website to tell you how to wash your hands and how long. Other things, you want to make sure you have good cleaning agents for your house so that you can clean high-touch surfaces quickly. And then I would recommend, just in terms of all emergency management, we get a lot of tornadoes through here and other kind of extreme weather, so to have some sort of shelf-safe foods that would be available in case that, for some reason that you happen to be in your house for a prolonged period of time.
Have you seen something like this before in regards to shortages of supplies, or is this kind of the first time in a while?
I feel like we see that every time that there's a tornado or winter weather coming through, all the bread and the milk are gone. It is common that people get concerned, and so getting ahead of this and explaining why we need to do what we do is, I think, key.
Can you give us just an overall status update on the coronavirus in Alabama, whether or not we've had any cases, any symptoms that look like it needs investigating?
Right. So in terms of Alabama, we have had 0 cases of the novel coronavirus. We do in our institution have a viral respiratory panel that does detect the standard coronavirus, which is the second most common cause of the common cold. So we see those every year, and that's not abnormal in any sort of way. In terms of our processes for potentially having patients under investigation, our travel screening works. We work closely with the emergency department to make sure, but we have not sent any testing specifically for that novel coronavirus.
I already touched on it. It's kind of a delicate line in terms of getting prepared, but also the mass hysteria going and buying things. Where do we stand right now with that? Do you think it's just just one of those things, stay calm, be prepared, kind of?
Yeah, I'm probably more on the same page as you. I like to be over-prepared in cases like this rather than under-prepared. I think there is a lot unknown about what is going on. What we do know is that Seattle is potentially having some community spread of cases, and that's up in the Pacific Northwest. We have not seen that here, which is good. But potentially, if we're unable to control this, we may see community spread kind of throughout the United States. So I think being prepared is important. Yes, as far as I'm aware, it is safe to open up packages from China.
And how does the coronavirus compare to some of the other pandemics we've seen, like anthrax and the Zika virus?
Yeah, so this is probably most like SARS because it is technically SARS-CoV-2, so it's very similar to the SARS pandemic that we saw in 2003, but the difference is the number of cases that we've had is significantly higher than SARS. And I will also say the case fatality rate is lower. So with SARS, about 10% of people died. What we're seeing right now is about 2%. And so I think that's reassuring somewhat, but still 2% is something that we want to be very much prepared for. In terms of Zika, Zika had a large number of cases that occurred very short period of time, but it was spread in a very different kind of manner through mosquito bites. So it requires kind of a different way of approaching that kind of outbreak.
And over the weekend, reports in Florida of a large scale of people that were quarantined and confirmed cases. With that so near Alabama now, can you discuss the threat concern and how that's changed in the past week?
So what I can tell you is that our healthcare system is very much aware of the concern for a pandemic, and we have great emergency medical response, and we have a great team, our serious infectious diseases team, and we work closely with our leadership in our hospital to ensure that our processes are in place to care for any one patient that may have an infection versus a potential pandemic. And so I think that our processes are good right now.
And I talked with you about this last week, but if somebody were to call in saying, I'm concerned I'm exhibiting symptoms, can you walk us through what happens next?
Right, so if a patient came in or called their healthcare provider, said that they were feeling ill, number one thing would be, are you ill enough that need to be seen by a healthcare provider? Because we do not want to prevent people from seeing their healthcare providers if they need to, because we have oxygen in place, we have medications, it could be something different. So we would really want to assess those patients if they need to be. If they do not need to come into the hospital, maybe they just have a cough, a cold, fever, we are working closely with Jefferson County Health Department and ADPH about whether or not to get testing for those individuals. If once a patient comes here to our emergency department, which is the best place to really assess them, we put them immediately into our airborne isolation room. They call me, they call our infection preventionists on call, and we go through whether or not this is a person that meets the definition. And then I work closely with ADPH in terms of whether or not they need to be tested.
The testing, we heard the state health officer talk about, they're just now getting to the point they've been okayed and they're training their workers for testing.
Correct.
Any other testing, as you mentioned before, is not the ultimate test.
Right, so right now, what has limited our testing has been because the CDC has been the main place to test. So I think it's great that the state health departments are able to start testing, and then I think they've also released this to be able to do it in a lot of our our clinical virology labs, which UAB has one in children's. And so if we can get that testing up and running, which it takes a process of being able to validate the test and ensure that we're doing the right thing. So once we get all of those in place, we'll be able to do more testing, which is actually good from an infection prevention standpoint. If we can get a quick answer, we can put people in the right rooms and then go from there.
How do you test for the virus, and how long does it take to yield results?
So I think right now, so we test patients if they can get us a sputum sample. We would want to do that, a nasopharyngeal or oral pharyngeal swab. It's all clearly documented by ADPH as to what to do. That goes to the CDC, and it should come back in 24 to 48 hours, depending on the day. And if we're able to get the state health lab up faster, then those answers should come back much quicker.
Senator, anything else you'd like to add?
You know, I think right now this is good that we are preparing as a city and as a state in terms of what could potentially happen. Number one thing is to wash your hands, get your flu vaccine if you haven't gotten that already, and to call your health provider if you are feeling ill and you're concerned about coronavirus. We are educating all of our providers to be able to answer questions that are out there.
Thank you.
All right. Thank you.
Okay, cool.